Hey guys, what's up? It's Jen Down with Adventures Upside Down. I'm coming to you today to talk about a subject that's really near and dear to my heart, and I'd love to get your opinions. You can comment below, but I'm basically going to come to you from a point of open-minded, but what I've experienced and what I know other people have experienced too when getting what's the word I'm looking for getting treatment for their mental illness. So personally for me, I can tell you that for the longest time I received anxiety medication from my primary physician, which many people do. Primary physicians are great for, simple, hey, I have a little bit of anxiety or small bouts of depression. There does become a point where things go outside of a primary care specialist's scope of what they're able to handle. And this is when people start to have to see a psychiatrist. I recommend anyone who has even like a little bout with this, get on a psychiatrist schedule, go see them. They may tell you that your primary care provider can continue to provide your medication. There's nothing that says you have to continue to see them, but it is good to know whether or not the level of care you're getting from your primary care provider is correct. So, a little bit about my story. My primary care provider was providing my medications. I was on a medication called Cymbalta, which is for depression and anxiety. I went into a severe depressive slump, and my primary care provider, she said, this is really outside my scope, and I really think it's time for you to go see a psychiatrist. The meds aren't really working, and I don't know what else to try. So the thing she doesn't know, the thing that is outside of her scope, is the idea of weaning off drugs and needing to be on a clean slate. So she believed that the best thing to do at that point, because I was out of medication, was to not give me a refill so that when I went to see a psychiatrist, he had a clean slate. I like her idea. Unfortunately, it was not one that was needed. I've talked to several psychiatrists since then, couple, that have told me that a clean slate is not needed for them to see me. They can, kind of work around things. So one, I was not weaned off my medication. I was stopped abruptly. And then two, I was without medication. Now, for anyone who doesn't know, it takes a good 2 months to get in with a psychiatrist for the first time. It's not someone that you can walk into an office the next time. So for me, I went weeks without medication, and I kind of fell through the cracks a little bit. Now, I know someone else who had the exact same thing happen to them. I also know some people who are in the military and they're only allowed to see military doctors, so they don't have an option to go somewhere else to find medication. So what are these people supposed to do? I know there's probably a shortage of psychiatrists to be able to help people, and sure, people fall through the cracks, but what resources can we as a community and as a civilization, provide to these people while they're waiting for the psychiatrist visit? If things get bad enough, do these people know that they can go to crisis? Do they know that there are intensive outpatient programs they can enroll themselves in? Is this information out there that they can understand that they have options other than suffering through till that psychiatrist appointment? I know I did not. And it was a very, very hard time for me. And once I got, to see my psychiatrist, he was like, I would have weaned you off the old drug and weaned you on the new drug at the same time. It doesn't have to be an off then on, and every doctor is going to be different, but I just wanted to share a little bit about what I've been through. If you've been through something similar, please let me know, comment below. We will have a continued discussion about this in my Facebook group. I'd love if you'd join. I'll leave that information in the comments as well, so come on over. We'll continue to have a talk about mental illness. I'll share ideas and tips on self-care, and I'd love for you to come over and check out the blog, so it'll be posted below as well. So thank you guys for tuning in, and I will talk to you soon. Till our next adventure.